Yeah, I'd say probably at least 50% of my cases get genioplasties. And what happens is it just depends on the facial requirements. It's very specific to someone's skeleton.
Hmm.
So some people have no real chin form. They can have microgenia independent of mandibular hyperplasia or hypoplasia, right? It's just the anatomy of the chin. Their chin can be asymmetric um, compared to the rest of their jaw. So usually what I'll do when I'm planning a case, I'm going to put their upper jaw, lower jaw in an appropriate position and orientation. And then if that chin point is off to one side, if it's canted, if it's too flat, if it's too long, if it's too strong, those are all independent factors for the patient that I'll decide to do a genio to make it appropriate.
Yeah. You know what I think happens, doctor, in in the lay community that becomes interested in jaw surgery, there's
Mm,
this sort of sexy idea that everything happens in harmony, so that if you're underdeveloped equally everywhere. And there's
exactly.
not a lot of consideration given to the fact that nature is not always elegant. Sometimes a person's upper jaw might be less underdeveloped than their chin, and their chin might need a little extra oomph. Is that kind of what you're saying?
Yeah, I love that actually. And I think that's very true. It's exactly what I'm saying. And I think that people want, dogmatic recipes and solutions. And they think of things very binary, like a genio is going to bring you forward, but a genio can move in all ways. And I'll use them in all ways. And you're
Hmm.
absolutely right. There are a lot of patients that have underdevelopment or overdevelopment, one jaw, both jaws in asymmetry, have plagiocephaly. They may have dystopia where one eye is higher than the other eye. But
Right.
you're right. Things depending on why something went wrong in the development for that patient, whether it was trauma, whether it was a kick to the face or an elbow playing basketball when the kid was 5, or
Hmm.
it was a genetic component, it was allergies, whatever that reason was that caused that deformity or to happen is not going to be the same for every person.
Hmm. Hmm.
It's
Right.
not going to be symmetric. It's not going to be one part in relation to the other part. So you're absolutely right. All the patients have very different needs.